Your hair looks good.
Don't
mess with your hair.
I don't think it.
Leave your hair fine. Hey, I'm Rebecca Gordon.
I guess we're filming. I'm Sylvia Gordon, and we are going to give you tips on how to certify for United Healthcare Medicare Advantage for 2021. Stay tuned.
Woo-hoo.
You or your downline agents have questions. We have answers.
Okay, so they're open. I'm excited. The season is here.
Opened up on July 29th or 30th.
No, I think it was June 29th.
Something.
Just
opened up.
One of the J months.
Okay, 2 weeks ago.
I got a call, which is a great question to kick off because I've had this question before. An agent just got contracted the 1st of June. The certifications that this agent did, is he good for
He's good
2020?
for 2020. No. So he needs to go back in now and do 2021. And we have, every year we have people, new people, or people, a lot of times it's old people, but they just get confused and they give their downline agents confusing advice. So if they got certified for 2021, they need to do their, or for 2020, they need to do their 2021. But if they come in right now, as of June 30th, and they do their certification, it will allow them to sell for the rest of this calendar year, your 2020s, your all the way up to your 12/1 effective dates. It's confusing.
Recap. If you get contracted now, June 30th, and certified, you are good to sell 2020 and 2021. If you got contracted and certified, say the beginning of June, you're only good for 2020. You have to go and now do 2021, right?
Yes, thank you. Now,
Done.
What makes our phone ring? What are the kind of questions that agents have?
You know, a big question that we get a lot is, can I do my certifications on my mobile device? And the answer is,
No.
no.
And that, I'm sure that will come one day.
Right.
You know, but no, we get that a lot. Clearly not by the majority of our agents. But the young people, they live on their cell phone, right?
Young bucks, they want to do it on mobile.
Not on a mobile device. Okay.
And what's the best browser? I cringe when people call me and ask me about browsers. I mean, I break out into a sweat.
Ta-da! Chrome. So this has been an ongoing problem that people call in and they're like, I cannot do this. I've spent hours. I'm so frustrated. I'm hateful. Yeah,
Ooh.
I'm you know, it's, when you're older, you get frustrated with technology quickly, right? You go in being frustrated.
Yeah.
So one of the problems we've had in the past is that Internet Explorer didn't work, or it was the only one that worked. Okay, so we'll have agents that say, my wife can't get in on her device. And we're like, what browser is she using? And they're like, oh, she's using Internet Explorer. I'm like, preferably you're going to use Chrome or Safari. And they're like, but I use Internet Explorer, and I had no problem.
Because they had the latest version of Internet Explorer.
And she might not have version 8 or higher.
A lot of layers to this onion.
So it's the same with Firefox. If you have Firefox, but it has to be version 2 or higher. And most of us, we don't know anything about this. Like, it came preloaded, or a kid set it up, or a grandkid, or whatever.
It worked last year, but not this year.
But when you're having trouble, that's what your FMO is for, is to hold your hand and help walk you through this. So one of the first things we're going to ask you is, what browser are you using? And you typically are going to go, I don't know. Okay? So look there. What's some more questions?
People going on to the UHC site, and they want to jump right into certifications. What should they do first? They need to click on the AHIP button.
Right.
And why? Why?
So we get agents all the time that are like, okay, I went in and did AHIP. Now I'm ready to do my carrier certs. And they paid full price for AHIP. What's that?
$175.
So they paid their $175. Now I know if I go in and I do it through United Healthcare, it's only $125. So how do I get that rebate or reimbursement, or how do they get that?
You don't. You lost it.
So we get that all the time.
Don't do it
you
that way.
You got to go in through
the carrier.
United Healthcare's portal.
Yes.
And they added something new this year called the Learning Lab.
Which is a great feature to really hold your hand.
So you're gonna, when you log in, you're gonna go to the top of your portal, click on the Knowledge tab, and you're going to see the Learning Lab. And they've made it, I don't want to say easier.
I think it's more agent-friendly, more intuitive.
Easier to use, okay? Easier to use. Really, really have had great feedback on the interface. Is that the right word? I know people are laughing at me. Is it the right word? Young person filming this?
Not sure what she's trying to say.
Whatever. They made it easier for agents to get around.
I would just say it's easier, but that clearly is
I don't want to say the tests
old
are
school.
easier. I thought the tests were good. I thought the tests were fair. They
Sounded
were
to me
good representation of what you needed to know. I thought they were good.
It sounds to me like they heard all the moans and screams last year from how
The
clunky
moans,
AHIP was.
The moans were about AHIP, not about United Healthcare.
Right, and so United Healthcare has gone that extra step to make it
theirs better,
which is
but
great.
And United Healthcare can't help you when you went into AHIP first. The first thing you do when you go into United Healthcare's portal is
Upload your AHIP.
go get your AHIP. So if you already did it through another carrier,
Upload it.
pull it in, or do it
first.
through them so you get that preferred pricing and save that $50.
That's a big deal. Don't mess
We
that up.
can't get you that money
Can't do it.
when you do it wrong.
When you do it wrong.
Now let's talk about attempts. I'm so full of graphics here.
How many attempts do you get? Not only for AHIP, but certifications.
Somebody in the comments put how impressed you are.
I am so impressed with
all my
Sylvia's ability.
graphics. Yeah, my graphics here. 6. Now, 6 is a double-edged sword because it's awesome. It's very generous of United Healthcare.
6 attempts.
That's very generous.
Right.
Because we have not seen that years ago. Like everybody gave you like 2.
But is that universal?
It's not universal. That's why I said it's kind of a double-edged sword because a lot of carriers, especially a lot of little carriers, your regional carriers,
only give you-
and some big national carriers only give you 2 or 3.
2.
So agents get confused because they're like, my grandkids were there and they kept interrupting me and then I got bronchitis and whatever, and I finally passed it. I knew I'd pass it. They weren't freaking because they knew they had 6 attempts.
Right.
So maybe they took 4 attempts because they weren't,
Right.
And it's no big deal. Except it was a big deal with, I don't know, Cigna or somebody.
Right.
Yeah. And so now they come back and they're like, well, Cigna, and I don't know for sure how many Cignas is, but I think
a generic carrier.
some carrier, and they only allowed 3 AHIP attempts.
And now they're in trouble.
So you can't certify with that carrier for this year. Because agents get confused because if I pay another $175, AHIP will let me take 3 more attempts, but that carrier won't recognize them. And we get agents that do that too. They're like, they throw more money at it. We're looking at 2 different entities. The AHIP entity has its own rules, and then each carrier will have its own rules. So we're not looking at 2 entities. We're looking at how many entities you have a book of business with. And it is confusing. So those of you that are yawning right now, if you don't have a downline, see ya. Keep scrolling. Thank you. Bye-bye. But if you do work, you're recruiting new agents, you have new agents, you need a refresher yourselves. Yeah, this might be the most 10 valuable minutes of your year because when you make these mistakes, they have long-lasting ramifications. Let's say you sell a 2021 effective date.
Okay.
And you got contracted at the beginning of June. You did your certs. So you were contracted for 2020, and you thought you were good because you got your writing ID, and you sell for that 2021 effective date. How do you go back and get paid for that? How do you fix that mistake? I can't let this keep scrolling because it's making my eyes hurt. Whoa.
You don't.
You don't.
You don't.
How do you get the money?
You don't.
But can we just pay them the money?
No, we've not been paid.
Nobody gets paid.
Nobody
Does
gets
your upline
paid.
get paid?
Nothing.
But does the policy get issued?
Yes.
So
The client is taken care
the
of.
client's taken care of, but you messed up, and
You
there's
messed up.
nobody to fix that. They're always like, "Oh, come on, can you just pay me?" Or
You just call 'em.
Can my GA just pay me? No, there's no money that flows to distribution if you weren't certified and appointed, duly licensed before the sale. Now, how about the smarty pants that procrastinates and says, "Oh, I don't think I'm going to sell DSNP with United this
Right.
year," but then they get a call and they're like, "Hey, can we come in at 3 and get signed up?"
And we say, hey, you got to get certified first. So they do the certification, and they want to come in at 3 to take the app. Can they do it?
Can they do the certification this morning and take the app this afternoon? Why not?
Because it takes at least 2 days, thereabouts, to get your writing number from UHC.
Yeah, so don't think that just because you got your cert in,
Right.
boom,
You're
passed,
good to go.
shows up on your portal. You have to get that writing ID before you're
take the app.
eligible to take that app.
It's not a lot of rules, but all of these rules that we are talking about are definitely worth writing down and just keeping yourself straight. Because these are the ones that if you break, you're not going to be happy.
And it's every single year.
every
single
single
year. We have some of our biggest agents and our biggest agencies that make this licensing, contracting, appointment mistake, and they won't find out about it for 10 apps or however many apps.
Right. Can you imagine that money lost?
And there's no way to get
Yeah,
that back.
it's done.
Now's the day. I always say the season's one in the off season.
Yep.
AEP is one right now in the pre-AEP. And if you have a lot
That's
of
a good
carriers,
video.
you know, like people in California that have like a jillion regional carriers,
Oh, God, yeah.
your agency needs to have a flow chart to break down
Absolutely.
because the rules do vary so much from carrier to carrier. And there's more generosity this year. We're seeing more carriers give
Oh,
you more attempts.
more
But that's
attempts.
not across the board.
Right.
Like I don't know whatever Pilgrim Health does in Massachusetts and you know some of these little guys, but you better know. You better know if you're selling for some of these little carriers that we don't know about because we want to help you be successful.
Yeah.
So
Have
if you
a great
have
season.
questions, ask us in the comments below.
Like, love, and share us.
And don't wait. Don't put off your certs because everybody waits
And then it's ugly.
and then it gets
Do it
messed
now.
up.
Be done.
Yeah, have a
Be done.
plan, execute.
Have a great day. Good selling. Thanks for watching.
Thanks.